What's up guys, Dr. Greg here back with another episode of Braces Explained. I hope you all have had a fantastic week and are excited for today's video, which is going to be on dealing with orthodontic pain. So you can really categorize the pain caused by orthodontics into two main categories. One is the dental, which is the pain caused to your teeth, and the second one is the soft tissue, which is the pain that's felt by your gums and your cheek from being irritated from the braces. So we're going to deal with both of them in different ways. So first, let's talk about the dental pain. Like I said in another video, how teeth move, remember how we talked about how there's pressure and tension around the periodontal ligament around each tooth? Well, what this is it causes inflammation in the bone where your teeth are, and that causes the pain that you feel when your teeth feel sensitive whenever you're having braces. Now, to get rid of this pain, what you have to do is decrease the inflammation. And there's a number of ways you can do this. One way that you can decrease the inflammation caused by dental pain is by eating and drinking really cold foods. You didn't hear from me, but you can eat ice cream and other cold things as long as you brush your teeth after you do that. Having cold food really decreases the temperature in your mouth and decreases inflammation, which makes you feel a lot better.
Another thing I can recommend is that when you get your braces adjusted, don't eat hard food for the first couple of days. You never really should be eating hard food, but keep it to a softer diet. So stick with the mashed potatoes and the rice for the first couple of days just until your mouth gets adjusted.
Another way you can deal with orthodontic pain is by taking medication. There's different categories of medications though. Anti-inflammatories are very, very effective, but they do decrease the tooth movement, so you don't want to use them for too long. Anti-inflammatories include Motrin, ibuprofen, and Advil. If you're able to, I'd recommend taking Tylenol. It decreases the pain, but it doesn't have a huge impact on your tooth movement. So if you can, take Tylenol, but if the pain is a little bit too severe, then go ahead and take ibuprofen or other type of anti-inflammatory. I recommend taking some medication before going into your appointment. That way, when we perform the adjustments, you will feel fine and you won't really feel it too much. Please be sure to read the bottles to make sure that you take the right dose for the medication, because I don't want to cause any toxicity. The second type of orthodontic pain is the irritation to the soft tissue, like I said earlier. Soft tissue irritation can be caused by both your gums as well as irritations to your cheek. Now, as you know, when you first get braces, your cheeks are really smooth and they're not used to this rough braces scratching it up. So early on to your treatment, I'd highly recommend using the wax that your orthodontist provides. So the wax that your orthodontist might provide you with come in containers just like this. And what you need to do when you get this is open them up and just peel off a little piece. Peel off a piece about this size, then roll it into a little ball just like this. Then you gotta find the area where the braces are irritating your lips. So if it's in the front of your mouth, you'll find the teeth that are really poking them. And what you should do is really just push the wax around your teeth and make it so that it's smooth. And here's a little bit closer of a look of what it will look like. By doing this, it'll push your lip away from the brackets and make it so that there's a smooth surface so that your lips can get used to the braces, and also it will allow for your lips to heal so that they don't continue to get irritated by the braces. Also, if you have some irritation on your cheek, at the store you can get something like Ambisol or another type of topical anesthetic. I'll give you a link to Amazon where you can find something that's really effective, and it's just a gel. You dry the area of your mouth that's irritated and you can put a little bit of gel on there and it'll numb you up for some time until you feel a little bit better. Also, be sure to keep up really good hygiene because your gums can get really inflamed during treatment. When your gums swell up and become puffy, food gets stuck inside of there and it becomes a vicious cycle. Food gets stuck, it hurts, it swells up more food gets stuck, it hurts. Don't do it. Please review my video on how to brush properly and stay tuned for a video coming up soon on how to floss properly to make sure that your teeth are as healthy as possible. And those are pretty much the main advice that I have for you guys regarding orthodontic pain. Like I said, it can either be dental or soft tissue, but hopefully some of the tips I gave you in this video will give you some insight so that you can minimize the amount of pain that you feel for your next adjustment. I hope you guys enjoyed this video. Please give it a thumbs up if you enjoyed it, and be sure to subscribe so that you can stay up to date with all of my newest content. As always, if you have any questions, please leave them below. For now, Dr. Greg. out.